I'm going to send that one more time. So it's going to send you an invite to join. Just make sure that you accept that. There we go. Hi there, Dr. Haque. How are you?
I'm good. I'm sorry we had some technical difficulty joining you.
Oh, it's okay. Me as well. And actually, I was a little concerned with the tornado warnings and all of that stuff, if this was even going to happen. But I was just making some small talk and talking about the reason for this conversation and how a lot of my patients have just been asking about, you know, with weight loss and body changes, what things can they do with extra skin and loss of volume in certain areas that they may not desire. And also trouble areas in weight loss. So we'll just kind of just jump in, and actually let's just start with an introduction. So if you can introduce yourself, your name, what you do, your practice.
My name is Haque. I'm a board certified plastic surgeon. I've been practicing in Charlotte for now 6 years. Before that, I was in academic practice at ECU for 5 years. My practice is pretty broad. We do cancer surgery, breast cancer surgery. We do cosmetic surgery and some hand surgery. So, we are kind of glad to be in Charlotte.
Okay, well, awesome. So tonight we're going to be talking about minimally invasive solutions for weight loss changes. And before we jump in, I wanted to get your definition of minimally invasive and how that is different from other types of plastic surgery that you provide.
I think as you're referencing, minimal invasive is a kind of vague term, and it's defined differently by different people. To me, minimal invasive is something that does not require a long incision, again, that can be vague, and that can be done in office with minimal downtime. Obviously, there's room, the definitions are a little vague, but I think to me, those are in the realm of minimally invasive, where you don't need to go to surgeries, you don't need to go to OR, you can be in the office with small incisions and not too significant downtime.
Okay.
I think it would be a reasonable definition, in my opinion.
Okay, that's definitely helpful. So let's start with, so I'll just go ahead and say this, the largest area is going to be saggy skin, excess skin, and abdomen. There's no question about that. So that's probably going to be, you know, the largest topics, but I actually, if it's okay with you, wanted to start with the face.
Sure.
Because I think that people think about loss of volume in the face, and we see a lot of people doing fillers and Botox and adding things back in. So can you talk a little bit about, as people lose weight and they lose volume, what in the face, what type of changes you see, and what are some solutions for that?
So aging happens with or without weight loss, and actually starts pretty early, almost starting at age 30. And you know, as I evolve, I know, but aging is a multifactorial thing. People age differently based on their genetics, race, their dietary habits, smokers, sun worshippers. So you can imagine there's a wide variety, but one of the main characteristics is that you do lose volume. And with weight loss, you have significant weight loss at a shorter time. So it just increases that same process of aging. So you lose fat any place you have fat. So most significant is around the eye. Temple actually is a place where people see, if you have significant weight loss, you see a lot of hollowing in your temple. In your eye, around the eye, you see a lot. In your cheekbones, to be around, you see people losing a lot of volume in their cheek. Those are the main areas you see a lot of it. But it goes literally from your head to toe, where you have volume loss and fat loss. I think we live in a great time where fillers and minimally invasive options are abound. And depending on how much volume you've lost and your expectations, you can replace it. And in plastic surgery, we try to kind of replace where to your we basically want to kind of fill volume where you lost it from. So you just don't put fat or fillers anywhere. I think you should put it where it was before to kind of get you back to where you were before. So, the filler options are like the most common ones are the hyaluronic acids, like Lift or Restylane. And the nice thing about them is that, you can dissolve them. They're short term, and there's a whole variety of them, which you can try. And depending on the location, you can put something that they last longer on the bone. Some of them are for more to augment your soft tissue. So again, aging and weight loss happens at all aspects of it, with the laxity and volume loss. And fat is the newest thing and when I say new, I mean for the last 5 to 7, 10 years, we've been actually taking fat from other places and replacing fat where we lost it.
Right.
The down part is it is a little more invasive. Still can be done in the office setting, but it's more permanent. So if you don't like it, it's harder to take it out. Versus hyaluronic acid, it will go away, depending on where you put it, for 6 to 12 months, and you can actually dissolve it, if you really don't like it that much. So to me, to start with something that's a little less permanent and then kind of going to more permanent probably is a reasonable option to go with.
Okay. So double chin. So we hear patients complain about this when they have excess weight, but on the opposite end, as individuals lose weight, this area may get a little saggy as well. So can you talk about some alternatives for how to find solutions on either end, whether it's a double chin or excess skin?
Yes. So I think double chin is because the prominence of your chin in your body, even a small amount of fat is visible and people notice it all the time. So even like, the same amount of fat somewhere else will not be noticeable. In the chin, it's very visible and it's part of your profile. So on the fat, if you have a little fat, you can actually go in with a small incision, again, in office, liposuction it. And then, again, we are living in this era of like minimally invasive stuff where we can actually go in. And again, there's multiple options, but one of the options that I like is going in with the radio frequency and kind of heating that area up to tighten that area up. For most part, people after 40, they don't, if you take out fat, your skin will contract. You can imagine, depending on your skin quality and your age, it might not contract as much. So obviously that's where you need to talk to your doctor and have a conversation about them. Sometimes you can just do liposuction. That might be an option. Sometimes you have to do body tight, where again, it's radio frequency heat, where we go in and very precisely heat up that area and kind of shrink some of that skin to kind of contour to your skin. And that kind of dives into people with the weight loss. They don't have as much fat, they have extra skin. So the question is what we do for it. And again, it depends on the spectrum where you are. If you have significant skin volume loss, then I think surgery might be an option. But if you are on the early stages or not that much, then you can still do body tight and shrink it and improve the contour. So you can imagine there's a whole spectrum of solutions depending on the how much loose skin you have and what kind of expectations you have and what kind of downtime you're willing to put up with.
Okay. So just to clarify, with the body tight, does that involve incisions?
It's involved basically less than a centimeter, like these small incision, where we can hide underneath your chin and behind your ears. And
okay.
But I think the nice thing about body tight, in my opinion, is you can be very precise. Versus things outside, I don't think you can be as precise how you can heat up different layers of fat and shrink up different layers of layers in a more precise manner, in my opinion.
Okay. So continuing with head to toe, the next area would be breasts for women. That may be a good thing for men if they're trying to get rid of gynecomastia, weight loss, but for women, there may be some sagging breasts or smaller breasts. So do you have experience where you've had to replace volume for women who have lost breast volume due to primarily weight loss, but I'm sure that also happens with other changes as well?
Well, it's actually a very common problem. Much more common problem is pregnancy, which is a similar problem where the breast, if increased volume, temporary increase in volume, and then the volume loss. So that's a very common problem in my practice where people have volume lost in their breast. And, it again goes to the spectrum. You can do, again, if you are a young, healthy person and just small amount of volume loss and your skin has a little bit sag to it, you can kind of do body tight on the top and shrink it up. Then you go down to a surgical option. At that point, you can put fat, again, if on the top part, to a small breast lift, all the way down to breast lift with implant. Again, depending on how much volume you've lost, and what you're looking for as your end result. So there's a spectrum of solution depending on the problem and your desired outcome.
Okay. Arms are a problem area, again, similar to the double chin and saggy chin, where when individuals have excess weight, the arms may be too flabby. As individuals lose weight, the arms sag. So this is one large area for just extra skin. So, you know, for individuals who tried the exercise solution, they may get some improvement, but they may not. So beyond exercise, what individuals are doing on their own, how would you approach those problem areas?
So I think arm is one of the more special areas where, you know, we are used to doing a surgical solution where we make an incision up here, but unfortunately that scar is, first of all, the location is bad because it's a very visible scar. Second, that scar, you know, routinely gets widened. So it's not, so it's one of the more difficult solutions we used to have. So again, depending on the spectrum, if you have, you know, just a little bit skin and a little bit fat, we can liposuction. And then we do minimally invasive or minimal access incision, meaning we do an incision just in your armpit and pull the skin up there. A small amount of skin we can pull up there. So combination of liposuction with the small surgery. Again, we actually have done a lot of them in my office. We can do in the office with minimal downtime and the scar, hidden scar. Obviously, if you have significant weight loss, that's not a good option for you. Maybe you do need the full surgical scar. So again, you know, I have a long discussion with my patients, and some of them are, you know, they have lost so much weight, they don't care about the scar. They really, you know, it bothers them enough that they want the surgery. So it's, again, depends on the spectrum and what your desired outcome are.
Okay. So loose skin after weight loss can be a huge issue cosmetically. You know, individuals don't like the way that it looks. It can be heavy. It can cause some other issues with, you know, rashes and skin touching. So this is definitely a very common area that I see for significant weight loss, you know, 100 pounds or more. So for loose skin, do you offer skin removal in your practice?
So I think for like people like who have 100-pound weight loss, I think surgery is probably the best solution, because you have to kind of take out that area. You cannot tighten that area. You cannot liposuction. So to me, you know, those people who have lost significant weight, doing less than surgery, I think a lot of times they're not satisfied because you still get the rash and you're not doing enough. So we usually will recommend for most of those patients that we do surgical excision, and that really does help them. And it's life-changing because, you know, it's just not only the weight, but the weight is off balance. So that I actually have patients who fell because they have this extra weight falling down. So I have an older lady who lost enough weight and she actually hit her head and had a concussion because she was off balance. So, you know, it's just not cosmetic. I think it's very functional need for those patients. So taking skin is, you know, just not for cosmetic, in my opinion. It's definitely functional a lot of times for those patients.
Sure. Yeah, for sure. Okay, well, let's talk about everyone's favorite area, which is the abdomen. Mm-hmm. So I would say the first question would be for an individual who has lost weight, but they still have a little bit of fat that they just can't get rid of. And we'll start with that before we go to skin. What minimally invasive solutions would you offer them?
So, you know, there's a lot of minimally invasive solutions out there. One of the things I always tell patients, because this technology is moving so fast, we don't have good data on it otherwise. So you want to go to a person that you can trust and have a conversation with them, because, you know, I cannot give you like, you know, this works and this doesn't work for sure. So in my practice, I offer them in-office liposuction and body type because, you know, I feel comfortable doing it. I can get them result. You know, I tell people my goal is not for you to have one surgery or like short-term patients. I want them to be happy and long-term patients. And you do that by getting them good results. So I think for small liposuction stuff, we can do it in the office. Awake, they're very comfortable. We do it all the time. And I think it also much, you know, they walk in themselves, they go home by themselves, they can work the next day. So downtime is minimal. And it's, you know, pretty comfortable for most part. So I think for small areas, I think liposuction, focal liposuction, with or without body type, depending on your skin quality, your age, is my number one uh, choice right now.
Okay. And just to clarify, when you mentioned that there are a lot of options that don't have a lot of data, would you be referring to cool sculpting and some of the heat stuff and the radio frequency things? And those are things I very commonly get asked about.
I think there's a lot of them. You're right. And I was just reviewing this before I talked to you because we had discussed previously, because you want to make sure we give good information to patients. We just don't want to be saying things. And I was trying to find good literature data, and a review article showed that just not good data out there to say this works or doesn't work. So I'd be the last person to say it doesn't work, because there's a lot of them, and I think a lot of times, depending on what you use it for, it might work. So if you use it, cool sculpt or something for small area, it probably will work. I don't have experience with it, but the data is not there for me to say yes, for sure it works. Versus
Sure.
like for other things, we do have it. So, and there's so many of them, and and people are coming out with all the time, and the technology is advancing at such a rapid pace. In fairness, it's hard to keep that much data, but as a physicians, I think it behooves us to kind of say, I cannot say good or bad, but the data, I cannot recommend it because I don't know. Nobody knows for sure who doesn't use it all the time and can stand behind their work.
Right. Yeah. And I'm pretty transparent with patients as well. I get asked about pole sculpting a lot. I don't know if it works or not. I just know that the individuals or patients that have done it have not had a lot of success or seen a lot of changes. They spend a lot of money, but I'm not quite sure if that really has shown any good data or evidence that it works. So I agree.
Yeah. So I think I'm just like you. I feel exactly the same. People ask me the same question, and I tell them there's no good evidence that I can say oh, you should use it or shouldn't. So you have to, I think that's where having a relationship with your plastic surgeon or whoever you see, so that you can have a honest conversation with them. Like any doctor-patient relationship, I think is very useful to have that kind of relationship, so you can have a trust. And that's, it all comes down to hey, will that work or not, and have an honest conversation with them.
Mm-hmm. Okay. So with the abdominal area, we started with just extra fat that people just, can't get rid of, love handles, muffin top. And I would also maybe put bat fat with that as well if we're talking about the upper torso area. So what about similar to the loose skin for, the arms, what about just loose skin? Would it again be more invasive, or are there minimally invasive solutions for extra skin that's hanging once people have lost weight in this area?
So it also, just like everything else, it depends on where you are. If it starts, it depends on the spectrum of how much extra skin you have. I think there's a fine line where minimally invasive stuff is not very productive. So I think as physicians, we should be honest with our patients, saying this is not going to accomplish our goals. Having said that, I had a patient who needed a tummy tuck, but she said she was taking care of her mom and she couldn't have the downtime. So we did a liposuction, and I don't think she was happy with it, but she was satisfied with the answer because she expected that. So to me, we have to fit the procedure to the patient's need and where they're in stage in life. Not everybody can take a couple of weeks off and not do it. She was actively taking care of a sick mother, and she said, and I was like, you want to be happy. She was like, I know, but this is my, I wanted something in between before I get and 2 years later, actually, she came back for a tummy tuck, to be honest. And so to me, I tell people it's just not about what makes me happy. It has to be something that fits in your life also. So as long as you understand it, I think you do, but I think once you start having significant weight loss with extra skin, I think surgery is probably the best answer to the problem, more direct solution to the problem versus trying to do, liposuction or body tight or any of those things. I think surgery probably is the better answer in those circumstances, in my opinion.
Okay. And if we have time, I just had two other areas, which would be buttocks and thighs. Do we have enough time to go through those two areas?
Sure.
Okay. So I think with the buttocks area, it's probably more, again, a loss of volume if someone has lost weight. Depending on the individual, they may like that or they may not like that. So for someone who would like to replace volume in that area, what minimally invasive solutions would you offer that individual?
So I think, that's one of the more popular things we see in our practice. We get called about, like, Brazilian. I think sometimes people are, I think in popular culture does disservice because they see that huge butt and that's like, that's not what I want. And I think for most people, having a more shaped buttock probably is what they're looking for. So I tell people the first thing we do is, minimally invasive will be, in my opinion, an office liposuction where we, liposuction the lower back, so you have a contrast between your lower back and upper and your buttock. So just having the contrast shapes your buttock because it's your body, your eyes sees the contrast. Second thing, the next level will be take some of the fat and put in your buttock. Again, I'm not talking about hundreds of liters, like, not 2 liters, couple hundred cc's at most, of just to shape it, because, like you said, you lose volume, and you lose volume everywhere. And what you see, like a lot of these people who have a frame but very flat bottom, and because they've lost volume. So, you like in medicine, as we talked about, you want to kind of replace what you've lost. So we put fat. And one of the nice things about doing, actually, we can do that in office, is it's actually one of the safer way of doing it. As you or other people might have heard, like people have, it's one of the more dangerous procedures we do because people were putting so much fat, and some of the fat was going to the muscle and was causing all kinds of problems. So in my opinion, and actually our society came out with a recommendation that we should not be putting anything close to the muscle. And I completely agree with that. So we just put it in your, skin and obviously you cannot put as much, which to me is fine, makes sense. Also, while you're awake, the safety comes from, like, your risk of blood clots is much less. Also, because you're awake, if I'm close to your muscle, you are the protecting. You're like, no, it hurts and you shouldn't be going there. Versus, if you do in the OR, obviously that might be an option. But, depending on how much we're doing and what we're doing, we can do in the office or in the OR. So there's both options and depends on your needs and what you want.
Okay. Do you have an opinion on injections, like the I think it's Sculpture, or I may be saying it wrong, but some of the injections that are FDA approved to add some type of filler or molecule in that area?
Yeah, so I think, people do that, and I think the problem with this, it becomes cost prohibitive most of the time because how much you need to put in there. It's a large area. And what I've seen is not those things, but people have put things that are not FDA approved. So I actually have taken out things like silicone and things which are not FDA approved, but I think people go outside the country and, they're like, oh, you have silicone particle being injected, and that's a very dangerous thing to do. So I think, if it's FDA approved, you can do it. It's just the amount of volume you need is significant. So fillers, to me, that's where it becomes, it becomes so expensive. And it's not permanent, then it's not as shapeable as your own fat. So I personally like fat better, but I think, if you have a small area that you want it filled up, or if you have a divot, or you have a little dimple that you didn't like, I think fillers is fine for that. Like, basically customizing a treatment to your problem. So to me, that's a reasonable option, and yeah, I think there's nothing wrong with it.
Okay. Fair enough. So our last area is the inner thigh. This is an area that can be very frustrating. People lose weight, they train, they exercise, they eat right, and they still have inner thigh fat, or they have thighs that rub together. Like the loose skin on the abdomen, it can cause some rashes or some chafing or some discomfort. Are there some solutions for removing fat in that area that you would suggest?
So medial thigh or thigh areas is almost analogous to your upper arm. The scar is not as good where location, it's in a difficult area. So I think but at the same time, depending on how much loose skin you have, surgery might be option. So early on, you can do some, just liposuction. That might be enough for some people, but it depends on how much extra skin you have. At some point, you might need surgery to kind of take off the extra skin. And the scar is the same issue there, so I think we have kind of improved our scar placement, but I think about upper arm and thigh in a similar situation where, I try to talk to my patient, make sure they kind of know where the scar location will be and what are the consequences of it. And for some, for people, some people it's fine and some people it's not. But I think, unlike your abdominal incisions where you can hide in your clothing, those are harder incisions for a lot of people to heal because they want to go to the beach and they're like, I cannot wear anything because I have the scar. I feel like as a doctor, part of my job is to make sure they see that's where it's going to be. I actually draw it on their leg just so they can visualize it. And at that point, they can decide for themselves, like, is the right decision for them or not? So.
Understood.
Yeah.
Well, this was great information. I think it's invaluable information. I wanted to give the audience an opportunity to get your information, know how to follow you, and also if you have any specials that you'd like to share, or if you want to talk about your consultations or any, things that you're offering in your office, please take this opportunity to do so.
So my practice is based in Arboretum in Charlotte, North Carolina. I think we're having specials all the time. You can just go to our website at Queen City Plastic Surgery, and we'll be happy to see any of your patients and work collaboratively with our other colleagues.
All right. Well, thank you so much for joining me. The playback will be available for those who missed the live. And I'll be going live again on Monday, so I'll see you guys soon.
Thank you, Dr. Minnie. I appreciate it. Bye.
Alrighty.